All right, I'm Petty Officer Foy, Gail Foy. I'm attached with HSC 22, who is detached to the USNS Comfort, here for better relations with Jamaica and continuing promise 2015. What I have behind me is MH-60 Sierra. We're in charge of packs, mail, cargo, medevac, and search and rescue for within the AOR area that we are operating within. Anything that you throw at us, we're more than likely capable of taking care of it. So we're in charge of transporting doctors and stuff like that, so they can ride along with us as well.
Good morning, ladies and gentlemen. My name is Captain Wiley. I'm the ship's master. I'm the person who actually operates the ship. I know Captain Sears and I often joke, is the ship a hospital or is the hospital a ship? Well, it's both. My job is to drive the ship, bring the ship where it needs to go, and also we keep the lights on, make water for the crew and everything. So that's part of what what makes this ship so unique is the fact that we run it as a hospital, but it's also run as a ship. So this ship used to be the Rose City. It was a super tanker. And then back in 1986, it was converted from a super tanker into a hospital ship in San Diego, California. The pilot house that you see here was the actual pilot house that was built as the super tanker. It was back aft. When the ship was converted to a hospital ship, the pilot house was cut off and moved forward and planted here. So this is it's a unique opportunity for someone like myself, because normally I drive oil tankers for a living. And to come on a ship that now has a hospital attached to it makes things certainly challenging for your typical tanker captain like myself.
Just like in a real hospital or a real setting. It breathes, it cries, and then the cyanotic, when they get blue lips, there's a little blue part that makes the nurse or a doctor know that they're cyanotic.
So you can hear it. This is one of our high fidelity simulators that we use to train doctors, nurses, and medics that come on board for the subject matter expert exchanges. This mannequin is able to simulate blood pressure, heart rate, an electrical rhythm, is able to cry, has a pulse. His tongue is able to swell. You can check fontanelles, which tells us that they have a head trauma or a head injury. The training that we do here is so realistic that sometimes we have providers like nurses and doctors cry when the simulated baby dies, because it's so realistic and so intense.
Lieutenant Commander James Clark, and I'm one of the diagnostic radiologists on board the USNS Comfort. Contrast heads for people with headaches, some altered mental status, as well as CT of the chest, as well as CT of the abdomen and pelvis, mostly to look for stones, or if people have chronic abdominal pain that the clinician is not quite sure of what's going on, we'll help them out that way.
Welcome to the Comfort. This is our main operating room. We have a total of 12 rooms on board. One of those rooms serves as an interventional radiology suite. We have 9 surgical subspecialties that are present on this mission, ranging anywhere from general surgery, pediatrics, ENT, urology, and others. We're here to work in collaboration with your country, and it's our pleasure to be here.
Hi everybody, good morning. Welcome to the ICU aboard the USNS Comfort. I'm Lieutenant Oates. I'm one of the ICU nurses here aboard the ship. I just wanted to say a little bit about the ICU. We're just so happy to be here in Jamaica and part of the Continuing Promise 2015 mission. We've been so happy to take care of patients in the host nations, especially here in Jamaica. And we've been so happy to work with our corpsmen and teaching them parts of taking care of patients and furthering their skills.
Show you our equipment on our way out. But the flow of the ship starts in CASRAC, goes to the operating room, then goes to the ICU, and then they go to the ward, and they come back through CASRAC to go back to the host nation or to wherever they need to go. And it flows very nicely. We're practicing before we went underway. This is a standardized patient that we train, and they actually are patients. They give you the same symptoms, and they complain about what's going on with their complaints, and then we take care of them. That is our new surgical suit that we used while we were underway. And start the patient from CASRAC as well, all the way to the operating room. CASRAC means casualty receiving.
Notice here with this cut suit, they're actually cutting into a suit that is worn by a real patient. They're putting in a chest tube right now.
This was a hypothermia patient that was practicing for man overboard, and it has a heart rate, it breathes, it cries, it talks.
So what you're about to see is a simulation. There is no actual blood, or this is not an actual patient. Okay?
We have to let you know it's all simulation. It will actually bleed just like a real patient, up to 1 liter to 1.5 liters of blood, and that's how we train everybody to stop the bleeding.